Good afternoon, everybody. I'm Sayukta, your host for today's live from All About Skin Wellbeing team, and I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some point of time in their lives. Urticaria is characterized by a round rash on the skin that itch a lot. It may be due to various factors, chemicals in certain food item, allergy to certain medications, instant stains, sunlight, and sometimes the cause is even unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age group. In today's digital world, it's always a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So today we have with us renowned dermatologist Dr. Anuj Kothari, who is joining us from Udaipur. He is working with an American medical college and hospital and also doing his private practice. A very warm welcome to you, Dr. Anuj Kothari.
Thank you so much, Nyokta ji. Uh, Good evening to each and everyone who is joining with us for this session on urticaria, and hopefully each and everyone will participate it so that we all can learn more about it and spread the awareness.
That's the whole motto, that's the whole objective. Very well said, Doctor. And it's such a pleasure to have you with us. And today, as we are talking about one of the very common, skin condition or skin allergy, we can say urticaria. We would first like to understand, Doctor, urticaria hota kya hai? What is urticaria and how is it characterized?
Uh, as you have mentioned, a few names like hives, urticaria, कुछ लोग इसे बद्दल, allergy, yeah, duffer, nettle rash. Lots of names are there. Basically, it's an allergic reaction to an allergen in which there is redness, itching associated with some swelling on the body part. And this thing usually goes off within 24 hours. So we can say कि शरीर पे कुछ लाल रंग के सूजन वाले चकत्ते आते हैं जिन पे खुजली आती है, and this rashes can be associated with sometimes swelling of eyes, lips, or genital part also.
Okay, right. So, Doctor, how do you categorize urticaria?
Okay. See, we can categorize urticaria or hives in multiple ways. The first and most common variety which we deal, we divide them into two parts. It can be acute or chronic. Acute वो चीज है which is lasting, or episodes of urticaria lasting for less than 6 weeks of duration. And if this urticaria is lasting for more than 6 weeks, we categorize it as chronic urticaria. Another way to categorize is spontaneous or inducible urticaria. Spontaneous urticaria वो urticaria है जिसमें without any pre-stimuli allergy comes up, urticarial lesion comes up, and in inducible urticaria there is some primary stimuli, most commonly in the form of physical stimuli like a scratching. It can be a contact allergy, or it can be by hot, cold, sweating, temperature change. Anything can be that. So another way is to classify it inducible urticaria or spontaneous urticaria. Routinely we see lot of cases of chronic urticaria into spontaneous category. Third way to categorize urticaria is that where we categorize on the basis of etiology कि urticaria किस कारण से हो रहा है. Right. Sometimes हमें उसका कारण नहीं भी मिलता है, but many times we can get the reason. For example, people call it food allergy. कि there the precipitant is some food, or it can be cholinergic urticaria where it is because of any physical exertion or change in the body temperature. It can be solar urticaria where the cause is because of sunlight, cold urticaria where it is because of cold temperature, heat when it is because of extreme in the temperature. So by the etiology also we can divide them into various types. So, but for practical purposes, for our understanding as a dermatologist, we divide them in acute and chronic and in spontaneous and inducible.
Fair enough. And doctor, what are the possible precipitants of acute urticaria?
See, acute urticaria, हमने जिसकी भी बात करी, which is lasting for less than 6 weeks, and most of cases the lesions are transient; they subside within 24 hours. In acute urticaria, most commonly it is seen with usually the child's, and in some cases adults can also be affected with the urticaria. In childhood, the most common causes of urticaria is atopic urticaria, where the skin is sensitive enough. They are sensitive to dust. Because of that, they can develop the urticaria. The skin is dry. They can also develop allergic rhinitis and etc. Another common thing is infection, most commonly viral infection, upper respiratory infections, where patient gets viral infection along with urticaria. Third thing is because of some drugs which we use in day-to-day practice, patient can be or the child can be sensitive to that, and that can develop urticaria. If we go for other causes, there can be food allergy, which is as per it is reported quite less, only 1% of cases, but I think it has been much more in the clinical practice. In food allergy, it can be because of if the child had something, maybe some nuts or some berries or some pseudo-allergen like preservative food, etc. And other causes are also there, which are in the form of like infestation, some worms, etc. In adulthood cases, most of cases acute urticaria are mainly because of some drugs or some acute change in temperature, etc.
Okay, doctor. और डॉक्टर फिजिकल अर्टिकेरिया किस तरह से कैरेक्टराइज किया जा सकता है?
ओके, फिजिकल अर्टिकेरिया की हम बात करें तो फिजिकल अर्टिकेरिया वो अर्टिकेरिया है वेयर there should be some stimulant, particularly in the form of any touch, scratch, vibration, or temperature, hot, cold, sunlight. These all things can be a stimuli which precipitates urticaria in the particular patient. These urticarias are very commonly elicited. We can easily elicit them in our offices, and patient will typically have the history कि जब कभी वो इस जगह पे या ये पर्टिकुलर एक्टिविटी करता है उसके बाद ये एलिसिट हो जाते हैं. फॉर एग्जांपल अगर हम सबसे कॉमनली बात करें दैट इज dermographism. In dermographism, whenever patient will scratch by any of the blunted object his skin, that part of the skin will become inflamed and red and patient will start itching. In cold urticaria, because of the cold temperature, patient can elicit by any application of cold ice cube. In solar light, when patient goes to sunlight, within that patient gets urticaria lesions. In hot, because of temperature. In some cases, because of physical exercise, like when they do exercise, that can also trigger urticaria. A very specific type of physical urticaria is which we call as cholinergic urticaria. In cholinergic urticaria, what happens? Patient gets tiny erythematous lesions or hives, particularly on the trunk part, which are after physical exertion or taking hot spicy food or emotional outburst. These things can contribute to development of cholinergic urticaria, which is very small, very transient in nature, lasts for around 30 minutes and repeats every time when the patient repeats the activity.
Right. You have so far so well explained all the factors that when they contribute or trigger urticaria. Doctor, what should be the focus of the physical examination for urticaria?
Okay. When a patient comes to us for urticaria, before proceeding to physical examination, we need to have a detailed history of that patient because that is very important. We have to ask the patient regarding how many numbers of urticarial hives they are having, since how long they are having, in which part of the body they are having more urticaria, at which part of the day they are having more urticarial lesions, maybe in the daytime or nighttime. Apart from that, we have to ask them if female patients are there, if there is any association with menstrual cycle. We have to take the detailed history regarding what they eat, where they went, what they wear, what they did at that particular time, so that we can get an idea if there is any particular pattern to that urticarial rashes. In many of the cases, we even cannot find any of the such attributes, and we classify it as spontaneous urticaria or idiopathic urticaria. After detailed history, we take the patient for examination. Particularly in physical examination, we can ask the patient if they are having any systemic features like fever, joint pains, etc., or upper respiratory throat infection. We can check that. We try to elicit dermographism in those patients to rule out inducible urticaria or the physical urticaria we talked about, or any other physical stimuli we can give to elicit that particular response. Apart from that, physical examination, there is nothing more to do for urticarial patients. But if sometime patient comes to us and says that my urticarial lesions are lasting for more than 24 hours and they are leaving some pigmentation, we can advise the patient to go for a skin biopsy also, where we take a small chunk of the skin, not more than a 4 mm size, to rule out other causes of urticaria, be it urticarial vasculitis, be it urticaria pigmentosa, or something else. We have to rule it out.
राइट तो एक क्लिनिकल इन्वेस्टिगेशन होता है, डिटेल्ड हिस्ट्री ली जाती है, जरूरत पड़े तो कुछ टेस्ट आपने बताया किए जा सकते हैं. व्हाट स्टडीज आर परफॉर्म इन द evolution of evaluation of urticaria, doctor?
Studies as of now, like if I'm taking it right, you are asking about any blood test if we want.
Exactly, right.
So in most of the cases of acute urticaria, we do not want any of the tests to be done. Most of the blood tests are for chronic cases where the urticarial lesions are lasting for more than 6 weeks. In those cases, we can ask the patient for a detailed blood examination where we check for complete blood count, ESR, CRP for any infections, or liver counts, their urine, detailed renal examination be done. Apart from that, to rule out any associated autoimmune disorder, we can ask the patient for thyroid illness. We can ask the patient for anti-nuclear antibodies for if there is any collagen vascular disorder is going on. Apart from that, in some of the cases of urticaria, that subset is particularly autoantibody urticarial lesions. In that subset, we want to rule out some autoantibodies which are occurring in the body against some allergen which is inside the body itself, like anti-thyroid peroxidase antibodies, antibodies against our own IgE receptors. For those things, we can do separate testing. In a very unique kind of presentation, which we call as hereditary angioedema, in that category, if history is suggesting to that and pointing out to the familial cases for the same, we can ask the patient for complement levels, C3, C4, and C1 esterase inhibitors levels. We can ask the patient for the same also. So it all depends on which type of urticaria we are dealing with. In acute cases, most of the time, no test is required. And in cases of chronic urticaria, sometimes a very detailed list of tests we ask the patient to undergo.
Right. And now the most important part, doctor, what are the treatment options available for urticaria?
Okay. So urticaria is a manageable condition. First thing we have to know and we have to understand. इसमें सबसे पहले क्या होता है, पेशेंट्स को एक मिथ ये है कि अर्टिकेरिया को हम कंप्लीटली खत्म नहीं कर सकते और इसका कोई उपचार नहीं है. तो दैट इज अ मिथ. Urticaria is easily manageable. Sometimes it can take some time to exactly know the cause or to adjust the treatment regime according to your body. So it may take some time, sometimes, particularly in chronic cases. But when we are treating the cases of urticaria, the most effective agent is antihistamines that we call as anti-allergic tablets. And that also sometimes patient has that fear in the mind कि ये स्टेरॉइड्स होते हैं या इनके कोई साइड इफेक्ट्स होते हैं. तो हमें ये समझना है कि these medications most of time are prescribed by a dermatologist according to your body type, according to other medications you are already having or any other disease which you are already having in your body. So they are usually most of the time safe agents and you can use them for particularly longer period of time. एक और गलती जो पेशेंट बहुत कॉमनली करते हैं अर्टिकेरिया के साथ, that is patient take tablets or medicine only when they are having urticarial lesions, and other times they just try to skip it कि मुझे allergy नहीं है तो मुझे लेने की जरूरत नहीं है. So we have to bust this myth that urticaria is a, particularly chronic urticaria, is a condition which is only a symptom. The disease itself in your body and the symptom is urticaria. So we have to take medications on regular basis. Apart from anti-allergic medications which we give, we have to titrate them up for the dosing so that at that time, for that particular patient, at that particular dose, no more urticarial lesions are happening. And sometimes when we do not achieve that with the one molecule, we can add other molecules also. And if sometimes in a very refractory cases, patient does not respond to those agents also, then we have certain medications which are prescribed by a dermatologist on the basis of your other blood tests and body profile, and we can give them in very, you can call it very refractory kind of urticarial lesions, which are basically chronic spontaneous urticarial lesions. There are antibodies are also available, particularly omalizumab kind of thing, that we can give as a subcutaneous injection form to our patients also, which are also very effective. And most of these agents are safe, but patient has to bear this thing in our mind that please do not take anti-allergic medications directly from the pharmacy, because they do not take usually your entire history and examination. So they can do some side effects, of course, but consult a dermatologist and they will titrate and set the regime particularly for your illness according to your body type and other illnesses.
बिल्कुल, बहुत जरूरी बात आपने कही है. ओवर द काउंटर मेडिकेशन नहीं करना है. इट्स अ बिग नो व्यूअर्स. और एक क्वालिफाइड डर्मैट से हमें मिलना है, उनसे एडवाइस लेनी है. एंड फॉलोइंग अप द डॉक्टर, ट्रस्टिंग योर डॉक्टर इज वेरी इंपॉर्टेंट. जो मेडिकेशन जिस डोसेज जिस ड्यूरेशन के लिए दिया है, प्लीज उसे कंप्लीट कीजिए. ये तो कई बार जैसा डॉक्टर ने बताया है कि हमें थोड़ा सा रिलीफ लगता है तो हमें लगता है बस हम ठीक हो गए और हम दवाई खाना बंद कर देते हैं. क्रॉनिक अर्टिकेरिया के केसेस में डॉक्टर ये और ज्यादा देखने को मिलता है, राइट? और क्रॉनिक अर्टिकेरिया की जब बात हुई, आपने कहा इनिशियली भी कि कई बार कॉजेस नहीं पता होते हैं, जितने इजीली हमें अक्यूट अर्टिकेरिया में कॉजेस दिखते हैं. बट स्टिल, यू नो, व्हाट आर द वेरियस फैक्टर्स और कॉजेस ऑफ अर्टिकेरिया जो प्रोबेबल कॉजेस हो सकते हैं?
As such, the list is very long. Any patient can get urticaria from any sort of things. I remember even my own mother, she was suffering from urticaria for a very long time, and when she herself diagnosed her after a thorough, because doctor told her कि आप अपना जरा नोट करिए कि आपको क्या क्या चीज करते हैं, कब अर्टिकेरिया होता है, कब किससे नहीं होता है. तो after many years she came to know that she is allergic to alum. पहले जो पानी में फिटकरी घोल के यूज करते थे, so that alum was causing her every time angioedema and urticarial lesions. So sometimes that thing can be very specific to you also. So we as a dermatologist always tell the patient that first make a medical diary. Try to note that जब आपको अर्टिकेरिया होता है उस टाइम पे आप कहाँ थे, क्या पहन रखा था, क्या खाया था, क्या एक्टिविटी थी, और जब भी ये एपिसोड होता है ये चीज अपनी मेडिकल डायरी में कहीं ना कहीं नोट करिए, so that when you come to a doctor we can come out to a conclusion कि okay, there are certain correlation with that. There are patients who gets urticaria because of post exercise. Few of them are allergic to latex also, so whenever they wears contact urticaria because of latex. There can be some foods also, but though that food is restricted to that particular patient, तो ये जरूरी नहीं है कि ब्लैंकेट फूड रेस्ट्रिक्शन सब पेशेंट जिनको अर्टिकेरिया है उनके लिए दिया जाए.
राइट.
फूड रेस्ट्रिक्शंस आर वेरी स्पेसिफिक. जब पेशेंट ये कहता है कि उसे खाना खाने के विद इन मिनट्स 2 आवर 1 or 2 hours अर्टिकेरिया हुआ, जब पेशेंट वो पर्टिकुलर फूड नहीं लेता है उसे एलर्जी नहीं होती, और जब कभी रिपीट करता है तो उसे फूड एलर्जी होती है. The list of food allergens is again very exhaustive, but most common are non-veg foods, fish. It can be meat products, milk in childhood cases very common. Eggs can be a cause. Then various nuts, including peanuts, can be allergic. Patient can be allergic to them. Various berry fruits, patient can be allergic to them. Even tomatoes also. Sometimes patients are allergic to pseudoallergens. Pseudoallergens कौन है? जो हमारे फूड में, पैक्ड फूड्स में जो एलर्जेंस आते हैं, जो ऊपर से हर्ब्स हम डालते हैं या जो स्पाइसेस हम ऐड करते हैं, समटाइम पेशेंट्स आर एलर्जिक टू देम आल्सो. सो ये बात हुई मोस्ट कॉमन फूड एलर्जेंस की। हमने बात करी मेडिकल डायरी की, हमने बात करी कि आपको अलर्ट रहना है, चीजों को नोट करना है, हमने बात करी फूड एलर्जन की। अगर हम बात करते हैं कोलिनर्जिक अर्टिकेरिया की, तो कोलिनर्जिक अर्टिकेरिया में द मोमेंट patient takes a hot shower or patient goes for exertion or some stress, alcohol, spicy food, all these things can trigger urticaria, which is very pinpoint urticaria lesions on particularly chest and back part. If we go towards physical urticaria, it can be because of hot and humid climate, windy climate, because of cold temperature, sunlight, vibration, pressure, list goes on. It is also there. So these are the various things we have to keep in the mind when we are dealing with a patient with urticaria.
So anything under the sun, and even the sun can cause urticaria. So
Yes,
yeah,
correct.
keeping a diary, keeping close eye is very important. Now, doctor, before we sum up the whole session, any take-home message for our viewers?
Yes, we have the take-home message for our viewers. That first thing is, please bear in mind, urticaria lesions are not contagious. ये छुआछूत से नहीं फैलते हैं. So you can, when a patient gets urticaria, try to attend to them immediately, because sometimes these urticaria lesions can also lead to anaphylaxis also, which can be life-threatening. What are those conditions? जब patients को कई बार hoarseness of voice, मतलब बोलने में दिक्कत आती है, the lips are swollen, tongue is swollen. In those cases, we have to be really very alert and quick and do the action immediately. Take the patient to the nearest hospital or medical facility as quick as possible. Try to the patient in such cases, if the urticaria lesions are too much and we suspect anaphylaxis, patient should lie down in supine position, legs up, air way should be clear. So these are the things we should bear in the mind if we are dealing with something very serious. Okay, about other take home messages, blanket food allergens या food हमें restrictions नहीं रखने urticarial patients के लिए, they are quite specific and there are quite less patients also for that. Another thing to bear, आपको over the counter medications अपने आप से नहीं लेनी है. Another thing is, अपने आप से steroid tablets या unprofessional जो practitioners रहते हैं, quacks रहते हैं, उनसे treatment urticaria के लिए नहीं लेना है. Yes, urticaria is cumbersome. Sometimes it takes time, and particularly chronic urticarial patients में more than 50% of patients को कई बार more than an year भी medications लेनी पड़ती है. But that's okay. You are not taking anything which is not under our supervision. So try to take all the medicines and adhere to the treatment plan. I think that should be enough for our viewers to take care.
Thank you so very much, Dr. Anuj Kothari, for your valuable time and a very informative session. Thank you so very much once again. It was a pleasure to have you with us.
Thank you, ma'am. Thank you, Sanyukta ji, for coordinating the session, and keep smiling. Thank you. Thanks a lot.
Thank you, doctor. And viewers, thank you for participating in today's session. To get latest updates on how to keep your skin healthy, do like and follow our FB page, All About Skin Wellbeing. We're also available on YouTube, Twitter, and Instagram. Thank you. Have a good day ahead. Goodbye.
Thank you.